We observed that adherence persistency program opportunities, especially those involving patient education, are well understood and widely used across the industry. We also saw evidence of increased commitment to improving patient persistency in critical care therapeutic areas through the use of therapeutic area educators. In fact, 57% of participants either agreed or strongly agreed that therapeutic area educators can have a positive influence on pull-through results. And some companies are bringing these educators on staff where patients have a chronic condition such as diabetes. Companies are also working with external educators to help them teach their patients. One sales manager told us, educators are one of the most overlooked areas of potential for us. They have the most one-on-one time with patients, and they're critical. We are looking for more ways to interact with them. Patient education, as I said, was the top, was most often rated by survey participants as among their top 3 most effective patient adherence or persistency activities, followed by physician-based programs, pharmacy-based programs, and third-party support programs, all seen in the top 3 by a majority of the benchmark labs. In order to have any hope of winning a plan's commitment to support your medicine above an in-place therapy through a therapeutic intervention, you need to be able to show at least 3 things. Your medicine has better efficacy, it's lower cost, and it offers a superior health economic outcome. If you look at a lot of the current healthcare reform ideas out there, they're focused on similar concepts, trying to drive down costs through prevention and quality to achieve better health outcomes. We saw 55 to 76% of the benchmark class rating those 3 areas among their top 3 most important therapeutic intervention tactics. 24% told us that therapeutic intervention programs can have a high impact on pull-through effectiveness, and 60% see a moderate impact. For patient education, survey respondents say that co-pays are the topic that has the most impact on increasing pull-through, followed closely by adherence. This isn't surprising given that co-pays are potentially very confusing to patients. One of the challenges for plans and field-based teams alike is to communicate this complex information in the context of pull-through programs. As you can see here, 2/3 of respondents listed copay as among their top 3. Adherence had 59% rating it in their top 3, but none of the other topics were listed in the top 3 by more than 31%. Clearly, physicians want and need new clinical data, and that is what most effectively opens their doors for access. Survey participants tell us 70 to 76% of participants find that those 2 topics are effective with providers. We did hear that practice guidelines make another highly effective education topic and can be used in innovative ways to drive pull-through. In some therapeutic areas, we observed that guideline shaping has the potential to be a powerful pull-through lever. For example, a diabetes client observed to us that guidelines for type 1 diabetes require testing 4 to 6 times a day compared with 1 to 2 times for type 2 diabetes, where most of the business is. And he observed that patients don't really get a good baseline with so few tests. He figured out that moving to type 1 guidelines for testing would improve type 2 patient treatment, and evolution to a type 1 guideline would incidentally create a market explosion for the glucose monitors and strips that the company sells. And the leaning toward shaping guidelines to go in that direction could double or triple the use of these products without adding any new patients for the company. Just to give you an example of the kind of innovation that's out there. We asked participants to rate the effectiveness of various communication channels and media for getting education programs out to their customers. And we saw that companies are using multiple channels to get the word out. Websites and special events are the most effective channels for communicating formulary messages to customers. But going to the additional channels ensures that they reach the widest possible audience. And in fact, a multi-channel strategy may actually be necessary, given that no more than a third of benchmark partners find any of the channels to be highly effective. And see, the most any event is rated highly effective is the most any channel is special events. One participant told us that best practice is to find out from the plan which communication channels it commonly uses for each of its customer segments, and then make sure to emulate those, because that's where customers are used to looking for their updates. Others told us that they were exploring emerging social and professional networking media for expanded customer outreach. For example, one interviewed director said, "We're trying some things with social media, but we haven't mastered it yet. There appears to be a lot of potential. We'll keep piloting things as resources allow." We also talked to people who told us that social media is being held up in part because of the federal ruling is being delayed on how to handle compliance. I have circled these two pieces to indicate that overall websites are seen as the most effective channel for reaching patients, however, for customers. But however, special events are the category that's most often highly effective. Newton, do we have any questions coming in?
No, Martha, not so far.
Okay.
I'm keeping my eye on it.
Okay. Well, moving along. As in other areas, key opinion leaders are the barometer of the market. We found that engaging them in speaker programs, advisory boards, clinical trials, and other activities can have a great impact on pull-through. More than 80% of study participants find that interacting with thought leaders has at least a moderate impact on pull-through success. And engaging them in speaker programs appears to have the highest success rate of any of the pull-through tactics. 83% overall and 35% high impact.